Hello, my name is Natasha. I'm one of the nurse practitioner students, and today I'm going to do a cardiac and abdominal exam. Are you having any pain? Are you having any issues? Good. Okay. Would you like to use the restroom before we get started?
No, I'm good.
Okay,
Thanks.
and you're good with the temperature in the room? Perfect. So it looks like our MA got your vital signs out front. Everything looks good within normal limits. Also, your height and weight look great for your age, and there's not been many changes since your last visit, which is also very good. So just noting the general survey here of my patient, she appears to be alert, she's oriented, her mood is appropriate for the exam, she's cooperative, she has good posture and good weight, and appears to be in good general health. Okay, so let me do some hand hygiene. All right, so just starting out, I'm going to do a visual inspection of the neck, looking for any jugular vein distension, which I do not see. I'm gonna palpate the carotid pulses. So I'm gonna touch you now, and my hands are a little cold. I apologize. Good. Those are strong +2. I'm gonna take a quick listen with the bell for any bruise here in those carotid. All right. Okay. Next, I'm going to palpate a couple more of your pulses. So I'm going to feel for radial down here. Good, strong +2, and brachial. All right. While I'm listening, feeling for your pulses, I'm going to do popliteal as well. And go ahead and relax your legs. There we go. Good, strong +2. And dorsalis pedis here on the top of the foot. That's also good, strong +2. Okay. So for the cardiovascular sounds, I could have my patient stand, be supine, and be laterally recumbent. For the purpose of this exam, I'm going to do them while my patient is sitting. So I'm initially always starting out with my inspection, looking at the precordium, visualizing if there is any lifts or visible heaves, which I do not see. Also visualizing if I could potentially see the point of maximal impulse. That would be easier, obviously, if my patient was wearing a gown and not clothed. Next, I'm going to palpate the precordium. I'm just feeling here for abnormal lifts, heaves, or thrills, which would be causing my hand to kind of lift, which I do not feel. All right, very good. Next, I'm going to take a quick listen. I do want to just palpate the PMI here, point of maximal impulse. So fifth intercostal space, mid-clavicular line on the left side. For females, it's usually right under the left nipple. And I'm just going to reach under your shirt here, okay, just so I can take a good feel. Sorry, my hands are cold. And usually on thin people, you can palpate the PMI. All right, so first using the diaphragm, I am going mid-clavicular line, second intercostal space on the right side for the aortic area. Second intercostal space, left side, left sternal border, mid-clavicular line for pulmonic. Three, second intercostal space, fourth intercostal space, and fifth intercostal space. And that is all Erb's point. And then at the fifth intercostal space, just moving anteriorly into the axillary line is going to be the mitral area. Good, strong S1 and S2. I did not hear any murmurs or thrills or split S1 or S2. Now I'm just going to do the same thing, but with the bell. Okay, and coming up here. All right, and no abnormal heart sounds found there. All right, before we move to the exam table, I just want to palpate your calves here. And do you have any tenderness as I go down?
No.
Okay, and I didn't see any signs of redness, so that would be a negative Homan sign. Any redness or extreme tenderness in the calf would be indicative of a possible DVT. All right, let's go ahead and move over to the exam table so I can take a look at your belly. Okay. All right. And are you comfortable how you're laying? Let's see. Okay. We'll go a little closer. Okay. All right. Okay, comfortable position? Good. I'm going to just lift up your shirt to expose your belly, okay? Let's get down a little bit, just start with my inspection. Okay. So always starting out with a visual inspection, looking at the contour of the belly, visualizing if there is abnormal pulsations, which I do not see, noting the size, shape, and contour of the belly, which is nice and flat, and I don't see any abnormal movements. Okay, so next I'm going to auscultate the quadrants for bowel sounds. I'm using the bell here. Right upper quadrant, right lower, left lower, left upper. Good. Good bowel sounds in all four quadrants. Next, I'm going to listen for some vascular sounds. So aortic, right above the umbilicus here, which splits off into the iliac. Renal. And femoral. Good. So no turbulent vascular sounds that I heard. Okay. Next, I'm going to percuss, and here I'm just listening from the gradient between tympany and dullness in areas which I would expect. So starting up right upper quadrant. Good, so good tympany throughout. Right upper quadrant was a bit dull, but that's expected. I expect the liver to be there. So starting, I want to measure the liver border. So starting inferiorly, I'm going to palpate, or excuse me, percuss and listen for areas of dullness, tympany to dullness. Okay, so here I would mark pen, And then starting up here, going in between the intercostal spaces, listening for that tympany to dullness. Okay, there. So I have about 3 to 4 inches of palpating the liver border, which is considered normal. Okay, moving on, I am going to just do some palpation now, starting off always with light. I'm just kind of getting used to my touch, and just let me know if any of these areas are painful. Okay, good. I didn't feel any abnormal areas that were hardened or anything abnormal there. So now moving on to a little bit deeper. No tenderness? Very good. All right. There are a couple specialty tests that I can do to look for cholecystitis and also appendicitis. So first is McBurney's point, which is palpation, deep palpation in the right upper quadrant. If I press here and have you take a nice deep breath in and release, if there is any cause of the cessation of breathing due to pain, it could indicate that there is gallbladder inflammation. In the right lower quadrant, right above the ASIS, anterior superior iliac spine, and to the right of the umbilicus is, that's McBurney's. This is, I'm not recalling the name, but I'm going to put deep pressure here. And if there is pain there, that could be indicative of appendicitis. Rebound tenderness is the same test. However, you do deep palpation and release. And if there is any pain on the release, it's indicative of cholecystitis. Rothsing's sign is the same, rebound tenderness, however, is on the left lower quadrant. So I deeply palpate here and release. And did you have any pain on the right side? So if there was pain elicited on the other side, it is also indicative of cholecystitis. 2 of the other specialty tests are the psoas and the obturator sign. So I'm going to just put my hand down here on the right thigh and try and lift your leg up against my hand. Good. So if there's any pain elicited up on this side, indicative of a peritoneal inflammation or appendicitis. And obturators, I'm going to kind of lift your leg here, bend at the knee, and internally rotate and externally rotate the leg. And if that elicits any pain in this area, is also indicative of acute appendicitis. Okay, well, that concludes our abdominal exam. Cover you back up here. Thank you very much.
Thank you.